What is medication reconciliation for stroke patients? Imagine walking into a busy hospital or rehab center after a stroke. You might be overwhelmed, but one of the most important steps to keep you safe is making sure your medications are correct. That's where medication reconciliation comes in. It's a careful process that compares what medications you are supposed to be taking with what you are actually taking. The goal is to catch any mistakes like missing medicines, extra doses, or drugs that could interact badly. For stroke patients, this process is especially vital because many are on complex medication plans to prevent another stroke. When someone has a stroke, they often need multiple medicines. These can include blood thinners like anticoagulants or antiplatelet drugs, blood pressure medicines, cholesterol-lowering drugs called statins, and sometimes medications for other health issues. If any of these are missed, duplicated, or dosed incorrectly, it could increase the risk of another stroke or cause side effects. That's why every time a patient moves from one care setting to another, like from the emergency room to a stroke unit or from hospital to rehab, medication reconciliation needs to happen. It helps ensure the right medicines are continued, stopped, or adjusted. The process involves 5 main steps. First, healthcare providers gather a complete list of all medications the patient is currently taking. Next, they create a list of new or changed medications needed during the current care episode. Then, they carefully compare these two lists to identify any differences. Based on this comparison, clinicians make informed decisions about what to continue, stop, or modify. Finally, they communicate these decisions clearly to all caregivers and the patient, often including written instructions for home use. For stroke patients, the most critical moments for reconciliation are at admission, during transfers within the hospital, and at discharge. When you first arrive, your medical team verifies your medication history to decide what to keep or change. During transfers between wards or care levels, they double-check to prevent accidental omissions or duplications. At discharge, the process is especially important because patients often leave with new medication plans. Up to 40% of patients have discrepancies in their medication lists at this point, which can be risky if not corrected. Why does this matter so much? Because medications like blood thinners or blood pressure drugs are key to preventing another stroke. If these are missed or incorrectly prescribed, it could lead to serious health setbacks. Studies show that involving pharmacists in medication reconciliation helps prevent errors and adverse drug events. Pharmacists review your medication profile, check for expired or unnecessary medicines, and ensure everything is up to date. They can also help include over-the-counter or herbal medicines you might be taking, which is important because these can also interact with your prescribed drugs. Patients and their families play a vital role too. If someone has difficulty communicating due to stroke effects, family members or caregivers can help gather medication information and ask questions. Education about what medicines to take, how much, and why is essential for safe recovery. Clear communication and accurate medication lists help your healthcare team make the best decisions for your health. In summary, medication reconciliation for stroke patients is a structured process that ensures your medications are correct and safe during every step of your care. It helps prevent errors that could jeopardize your recovery or increase the chance of another stroke. Always work closely with your healthcare team, ask questions, and make sure your medication list is accurate. Remember, your safety depends on it. And always consult your doctor or pharmacist for personalized advice tailored to your specific health needs.